I'm so sorry. Okay. Andy Hornstrom. Kyle Patterson.
Here.
Danielle Cheney.
Present.
Thank you.
All right, public participation. Any members of the public? All right, seeing none. Old business, looks like we have none. New business, discussion of items the Board of Health should approve at monthly meetings.
Okay, so this came about because, you know, I've been here forever, and we had various things that were approved and weren't approved based on Fred, basically.
Okay.
So we have some things on there that, to me, it doesn't make sense that, it makes sense that they're known about, but not that they're held up. And that would be, a good one would be the grants. If the money's coming in, you know, I don't think you're ever gonna be like, so we apply for grants, and then we get the grants. Usually we're talking about state grants, not new ones or smaller ones, but the idea is that we're able to get some of these things signed and then we can still put them on the agenda to say that these were signed or whatever, but not to have to wait for a board meeting in order to get approval to sign it. So there's some things like that we still want it to go through legal. A lot of things would go through legal. I don't know about the standard grants. I don't know what Ruth thinks about it. If she even thinks that's necessary.
It's a little hard to have a conversation without legal here. Is
Yeah.
Ruth not coming?
Well, I thought she was coming. Is Ruth coming?
She knows about it.
I haven't heard that she isn't, but
Okay.
yeah.
So so I read through everything, and it's unclear what is being asked for. Like, is there, it's also unclear if there's a disagreement between Mandy and Julie. So I don't, so
No.
if you maybe state what your proposal is and why, and Mandy, if you have any concerns with that proposal, that would be helpful for me.
Yeah, ours, I don't think ours are disagreeing with each other.
We never had a discussion about it, so
No,
I
these are
reacted.
just things that we want to put out there to see, like, what do you and Ruth think needs to come to the board as opposed to what was maybe just being brought to the board.
The only thing that I have an opinion on, was that they were suggesting possibly moving the check request and requisitions threshold up to the board. But that's an internal control feature, and I consulted with the auditors and Ron, and all three of us believe it should stay exactly the way it is.
Which is,
At, everything 5,000 above goes to the board. And
yeah,
So that one.
so everything greater than 5K would go to the board in terms of expenditures,
Correct.
right? And then everything above 1,000 goes to the director, meaning you, Julie.
no,
Okay.
1,000 for the director is us out here. And then 5,000, up to 5,000 goes to board, Julie.
Me. And then everything over 5,000 or over goes to the board.
So who's the they that wants to raise the board policy purchasing limits in your email, Mandy?
Who's what?
Who's the they? You said they'd like to raise the board policy purchasing limits.
I was not part of the original conversation, so my assumption was that it was the directors and Julie all talking about it.
Yeah,
So I
could it
talked
be
about
raised?
they as
I'm
general.
going to be raised.
But then we found out it could not.
Okay.
That
So-
sort of took care of that one.
Yeah, and it looks like Anthony responded and said he thinks the threshold should remain over 5K comes to board. And this is in terms of purchasing. Now, during COVID, we had a situation where we had to make rapid purchasing decisions, and I was the chair at the time. I'm no longer chair, but there were moments where I would authorize a purchase, and then it would come to the board.
Mhm.
And in other boards I sit on, typically there's like a purchasing process policy that basically says if it's an emergency purchase, it may be approved by the executive director and the chair of the board, and then retroactively reviewed by the board.
Yeah.
So
We
the
have that
emergency
policy in
policy-
place.
We do.
Yes, we do. The
That's
emergency policy doesn't address that to say, it just said it raised the limit right now, the board goes to 5,000 and above, but the emergency was, 20,000 and above.
Emergency policy is for
20,000 and above, and it's restricted to EOC operations. But this also goes back to where the board adopted a policy a couple of years ago or something that you could do the ratification and the chair would do the ratification.
That's what I thought.
Yeah, but Andy is also saying he doesn't want that to happen on an ongoing basis.
I see.
But, I mean, to me, I would like, an emergency, he's not gonna say no. I mean,
Yeah.
an emergency is an emergency.
Okay, so basically, just so I understand, we have a retroactive ratification policy in place, which is like what I thought, since we
We do.
used it. We also have an emergency policy in place for EOC operations only. And essentially, that takes care of emergency purchases at that time, at this time. You feel like you're taken care of in terms of emergency purchases that are needed under those two policies. Okay, so then the question is more what needs to come to the board, and I guess my legal question.
And
Go ahead.
these are not, this is not necessarily money going out things that we're asking about. We're just wanting to know, what do you actually want to see, you know, ahead of time and get approved before? Because the one thing that I think we find probably most
Yeah,
cumbersome is the grants, because we, you know, they apply for the grants, they get the grants, I need to sign the grants and get it back, because usually IDPH gets us the grants late anyway.
yeah,
So we would like to just sign those, get them through, and then I can still give you a list, you know, if you want, to show what's been signed for the month. But that was just something, that didn't used to be like that, like, if you look back at old things. Fred put a lot of things to go to the board that we don't even know if the board wanted. This was before you all.
does the board choose what we see, or is there statutory limitations?
There are some things that you have to see, yes, but,
And you know, this is
But
a question I have.
some of them, I mean, obviously, there, you know, there are some, like you set the policy, so you would have to see the policies.
Mhm.
But, yeah, I just don't know the thing with the grant agreements, and some of it's, my question is, if it gets approved through Ruth, because that's really what we're
Mhm.
looking for, you know, to make sure they're okay, if it's approved through Ruth, we go ahead and sign it and get it moving.
Mhm. I don't have
Those are
concerns
the
about
major-
accepting grants.
Yeah.
I want to make sure we're within our statutory authority, so that would be a question for Ruth. But in terms of accepting monies in,
Yeah,
then I'm very aware of the delays in state grants, and that every day you wait seems to compound by 10 days.
it does.
What it takes to get here back from them. So I don't have any problem with that, as long as it's within our statutory authority to basically allow, you know, to approve grants. I definitely think, I mean, I support anything over 5,000 going to the board. I wanted to keep that. I support having an emergency policy, which we have. Is there anything else on this list that is cumbersome for you all? Like, for example, with the annual holiday schedule, I don't feel that we need to approve the schedule, although I did change Columbus Day to Indigenous Peoples' Day, because if you're gonna bring it to me, I'm gonna change it. But, like, if you were to expand the number of holiday days,
Yeah,
then
that's,
that's a compensation issue. I would want that to come back to the board, but it's actually real compensation. But if it's just shifting which days you were going to have as your holiday schedule, I don't feel the need that needs to come to the board.
One of the things that I put on here is the job descriptions. Right now, you two probably don't know about this, but I talked to Andy about it. We're doing a compensation study. We hired a consultant, and that will be on well, we haven't hired it, the board will approve us hiring that consultant. But I've had to revise all of our job descriptions, there's 50 of them. Some of them very minor things. Does the board want to, on October 17th, review all those 50 job descriptions? Or if, are you good with them if there's no major changes? Or I guess that's my question for you. What is it that you want to see with those?
I would say I'd like to see when there's a new, like,
Category.
leadership level position or higher, like, we can
Okay.
decide where that is. you know, if it's a part-time maintenance person, that person's very important to the operating, but like, I don't feel like the board needs to see it. But I would say, like, I would want to know if there's a new department, there's a new, even with the grants, actually, I'd like to be aware of, and retroactive is fine, but we have this new initiative, we have a new grant, we are providing a new service, we have a new, you know, those pieces. And then,
A lot of these are just ongoing grants though, too.
Yeah.
They're just-
exactly, so when it's a new, it's helpful for the board to generally, I would say, my experience as a board member for 5.5 years is that I am still trying to see public health, you know, as a whole, because there's so many pieces to public health. And this is maybe not relevant to this discussion, but what would have been great for me coming on board is to like, and I did get like the tour, I mean, Julie, we walked through the whole place, we talked about each piece, but to maybe hear from the different divisions when there are shifts or changes happening. It's not a decision-making moment, it's more like, we're, you know, like we're launching this new initiative and this is how it's gonna impact programs because we're ambassadors for public health. I mean, I get calls, you know, all the time about how do I, you know, this public health thing, that public health thing, and I'll direct folks the best I can, or reach out to Julie and bug her after hours to try to direct people. So I think that, like, understanding big shifts in the organization, and strategic planning things, different priorities, swapping, if we get rid of a program, I'd like to know about it before someone calls me about it, or it's in the press.
And I think those are things
kind
we
of
want you
things.
to know about.
Exactly.
The things I'm talking about are just routine changes to a job description because we want maybe want to hire someone that has less experience.
Yeah.
And that is an new initiative that we're trying to do is bring people in who doesn't have necessarily a bachelor's degree, but they have experience in that capacity. And so we need to change the job description. Do we need to wait for the board to review that before we make that change?
That sounds like a Fredism. And I don't feel like changes in job descriptions are necessary. I want to know things that have large fiscal impact, so like,
Gotcha.
I definitely would say if there's like changes in jobs between pay ranges on the leadership team, I think the board should be made aware of that. And we should see it. If there's a new leadership, I feel very comfortable with where public health is, but we're setting policies for the next 10 years.
Right.
So I've seen government agencies proliferate administrative positions like they're rabbits in the spring, and it's like, oh my God, what is going on with how many of those do you need? And I think that the board has to know if there are new, expensive administrative positions being made. The board should approve those before they're made, or else we end up with these very top-heavy government agencies where services are reduced as administrative pay goes up. So I would, those are the kinds of things where I would want us to approve in advance. The creation of new positions that are, I don't know, you all could come back to us and say their leadership level, maybe their department and coordinator level positions and administrative
I could bring
positions.
that to the next board meeting for review, and we can look at those job classes and then just approve it, I guess.
Yeah, but in terms of like what educational, I mean, that's changing all the time, and you all, I feel
It
like
is.
you need flexibility to be able to
Okay,
change
perfect. Okay.
job descriptions and change those classifications.
Okay.
That's my opinion at least.
And then the only other thing on here for me that it's under the checks and requisitions, it's just that sometimes on an annual basis, we renew our property insurance, we renew our auto insurance policies. Are those things that the board needs to see? Software maintenance agreements, do you want to see those? If they're routine purchases that we do all the time, or that's kind of just the conversation we had, and we just kind of wanted a guideline for that.
I would like to bring up that the purchasing policy does say that if it's routine transactions, meaning that it's in the same dollar range for the same service, then it doesn't have to go to the board.
I don't think I've seen all the red rules. It might be that we want a percentage, like if something goes up beyond 15% or 20%, it, it would come to the board. And if it's a new agreement, those seem to be.
Okay. And I guess, what about, and I know Ruth's not here, but what about sending that stuff through legal if they're renewals? Those are some of the questions that kind of come up. Does this need to go to Ruth? And that we are really not sure.
Yeah.
Everything used to have to go through Fred.
Yeah.
So we just routinely knew that, but
Yeah.
we just don't really have that level now of understanding what should go to Ruth or not.
Well, I'll tell you a sad IMC story, which is that we had a renewal of our energy contract, which was not a renewal. It was actually Direct Energy trying to basically, and so we got locked into a 3 or 4 year contract that had an escalator. And the IMC was really financially pummeled by that, and so the operations person thought they could just renew this, because they were being scammed by Direct Energy if they were calling it a renewal, and they ended up switching companies. So I do really think it's important with renewals that there be due diligence to make sure that if you're signing a document, someone needs to have read the entire thing, whether it's a renewal or not, from the top to the bottom.
Okay.
And unfortunately, it's incredibly boring and tedious. It can be expensive for a legal person to do that. So my suggestion to you all, for what it's worth, is that someone is assigned and it is their job, and they will be held accountable for what the document says. If it doesn't go to Ruth, then someone in the CUPHD actually has to say, yes, I will be accountable to being scammed or not. I will have to have read the entire document.
We did have that happen with Service Master, remember that?
There's a lot of predatory
They came in
behavior.
with a paper and they made it look like they were just signing to pick up the new rugs. And like a secretary in the front office signed it. This was in the old building a long, long time ago. And it was a nightmare.
Yeah.
It was a nightmare to get out of that thing.
And we tried to get out of it because this person wasn't even authorized to
That's the
sign a
same
new
here. She
contract.
wasn't authorized
And
to sign.
and we had a lawyer involved, and we tried to take them to court, and we actually, what we did is we finally just stopped paying them and let them take us to collections, and we refused collections, and we're like, cool, take us to court, and we have all the evidence. But it was years before we did that. So I really think, when you're signing a document, it may feel like it's routine, especially around insurance, changes all the time, property insurance, car insurance. These things seem routine and they're not, because there's all kinds of even in organizations that seem legitimate, there's kind of predatory behavior that happens. I had to do something with CLA. They're a very reputable accounting firm in town. They're not predatory in my opinion, but they had added on a technology fee that was pretty significant to Cunningham Township's bill. And if I had just signed that, then we would have been stuck with that. But I had to read through the whole thing. I sent it to, I don't send a lot to legal review because I do my own legal review, but I'm not arguing that that's a good idea all the time. It's just that I actually feel like I pay more attention than our lawyer does to the details. And if I have any questions, then I bring things to him. So I just, word of caution about renewals, they're not always renewals. So I think I would encourage you to check with Ruth and be like, here's a renewal, and I would make sure one, internal staff has read the thing no matter what, so you know what you're signing, and then they can flag, is this different or this seems strange?
I generally am the one who reads those
Okay.
agreements to make sure
Okay.
that
And
they're,
mark something if it's gone
Yeah.
strange from the last year.
Yeah.
It's easiest to do that if you have the old contract.
Mhm. Yeah.
Yeah.
And then I feel like policy revisions, all new policies, yes. Policy revisions beyond minor changes, yes, but policy revisions that are technical, like updating a name of a thing, or, small typos or grammatical issues or restructuring, again, Kyle, feel free to speak up, Kyle, but this is my opinion of having to administer all this stuff all the time.
I agree with a lot of what Danielle's saying, as I think she previously said, my only concern is if there's statutory obligations for the board to approve certain things. And so it'll be good to hear from Ruth about that.
Okay.
Yeah, so whatever we comes to board, if she can review that, and then we'll give her opportunity. What about building emergencies? Is there
I
something?
think that's covered.
Okay.
Yeah, I think we just
We
talked about that.
covered it. We
Okay,
just want to
we
make sure
covered
that's okay, because
emergencies.
we've had, you know, we've had issues, anything can happen with this building, and often does.
Yeah.
And so we need to, sometimes it's more than that, so we spend it, but we will take the quote or the invoice or whatever and send it over for approval.
Yeah. It would be nice with new board members if there is a list like this that's in, like, once we finalize this list, to be like, here's the things that you reviewed, because actually every board is really different. Like the, you know, like the town board doesn't, by statute, actually doesn't have the permission to like approve new personnel. It's really the supervisor's role, so different forms of government act different ways. And so it's helpful for board members to know. It's always been a puzzle to me, like why, you know, why is it that we see what we see? Some of it's obvious, right? But
Some of it is literally after veto, Fred just decided that everything was going to go through him, because clearly we weren't able to run the agency.
yeah,
So,
so I think you're doing,
there
I
was
think
that.
you're doing just fine. Thank you very much.
There was that, but, and I think that is when we got all of a sudden, like, everything started with the board, and I think our board members were like, what? At the time, like, but yeah, there are some things, I mean, I know that the board has to approve policies, and, you know, there are certain statutory things, there aren't a ton,
Yeah.
but, well, we'll have to get those.
So, of the 50 job descriptions that I have reviewed recently, all of those are not as described here with leadership positions, changes in anything substantial, just education requirements. So what I'm hearing is that I don't need to bring those to the board for the October 17th to present them to our consulting firm. We're using CLA if the board approves that.
Yeah.
So, is that what I'm hearing?
Yeah.
Okay. And if there were any major changes, then we would bring in the future, anything that had to do with any leadership. But I will put together a list and ask that the board review by job classification which ones they would
Yeah.
like. And that way we'll have
Okay,
it.
that would be helpful. Yeah.
We'll
then we can
formalize
maybe
this for, any future boards or anything like that, so,
Yep.
okay. And we'll probably have to tweak it a little bit before we get to where it needs to be, but.
Yeah. And just as a FYI, when I do receive emails about openings at the board, I do pass them on to people in the community who I think, so I mean, I'm happy to, continue to play an ambassador role as well. So if you do have job openings, or I know it's been hard to hire recently. And so I've been doing, I feel like I'm doing a lot of matchmaking, so I'm
That
happy
would be
to.
excellent.
I will oftentimes say, I think this is a great place to work, and here is, and here's some openings that are happening, so feel free to send us my way.
Okay.
All right, next on the agenda is comment on board policy regarding purchasing limits.
We already did that one.
Yeah. That's what I was thinking. All right, so just next meeting is CUPHD Board of Health meeting, Monday, October 17th, 2022 at 4:30 p.m. at CUPHD, and this was rescheduled from October 10th. And then a study session Wednesday, October 26th at 10:30 a.m. at CUPHD. Do we plan on utilizing that one?
Probably not, but you never know. We always have it on there just in case, and then we cancel.
Cool.
If we don't have anything that we think of right now, we're gonna need that for.
Okay.
But who knows?
All right, seeing no other business, this meeting's adjourned.
Thank you. Thank you.